Tell me a little bit about yourself and how you came to be at C.W. Williams Health Center.
I have 2 degrees, one in accounting and one in economics, and it's kind of odd how the good Lord has woven his web around me. I grew up in an orphanage, put myself through college, and virtually all of my career has been spent with nonprofit organizations. It's a way that I give back, and I have a great empathy for people who need to use nonprofit organization services, because I know I was there. Okay. About 1975, I was hired by a company who actually did strategic long-range planning for hospitals and nursing homes. And I worked for them for 5 years, and they were doing it under contract, and I felt like I was doing all the work on the contract, so I launched out on my own, started my own consulting company, and then got hired by a hospital corporation in California to be their vice president of finance. And that's how my career in healthcare began.
What have you seen as the biggest change over the last 10 to 15 years, in your opinion, for the health center?
Like, we started OBGYN. We had that when I first started here 10 years ago, and we lost it because we were using midwives and the physicians in town wouldn't sponsor them anymore. So we lost that program, and we were approached by Presbyterian Hospital to start OBGYN again because there's such a need in this community for that. But that also didn't work out. The doctors were in the hospital a lot more than they were in the office. Right. I think the changes that we've seen over the 10 years has been an increase in sliding scale patients or uninsured because of the economy and whatnot. We see a real big increase in that. We're trying to, we started the Midtown Medical Office, and that grew our practice quite a bit.
Tell me how that practice is different from this site here.
It's really the same. They have family practice over there now. We did have some internal medicine physicians there, but now we have all family practice. And we also have a physician and a nurse practitioner doing a women's health clinic. We have pediatrics over there as well. And over here we have pediatrics and family practice. So there's just more physicians over there.
During the 1990s, Medicaid was farmed out to a number of HMOs, some of which have survived and some of which have not. Tell me how C.W. Williams has survived. What has been your success in surviving?
Well, the dedication of the staff and the providers. I mean, they could probably go somewhere else and make twice as much money as they're making here, but they stick with this center because they have it in their heart. And the other way that they've survived is just keeping their eye on what's available in grants, supplemental grants that we're getting. Fortunately, Medicaid is one of our best reimbursement streams now. We have patched together a lot of little grants. We had Ryan White for a while, who has gone out and gotten us special funding from Susan Komen. We have a homeless grant that we actually go to the site where the homeless people are and give them medical services, and they can also come here. Our biggest challenge, as you can imagine, is making a net. Just a zero budget, and it's very difficult because most of the communities think, because we get a federal grant every year, that we don't need any other support. Well, that's not true. Our federal grant's about $870,000. Our operating budget is $6 million. Last year we wrote off, I think, about $800,000 for sliding scale patients. the percentage of sliding scale encounters to our total encounters is about 24%. Our budget for the federal portion of our budget is only 16%. So intuitively you can see if we're given that kind of a spread of services to patients who can't pay, then we've got to find some other sources of funding.
How do you see the current health care reform affecting C.W. Williams? Positively, negatively, or not at all?
It's kind of hard to say because I don't know what the reform is and no one else does. But in a perfect world, if my man Obama got everything he wanted, we would be strategically well placed because he has commented that he wants additional funding for centers like us because we're community based, we're nonprofit, we give services to segments of the population that wouldn't otherwise get services. So I'm praying that it moves along and the Republicans will all be sick one day at the same day and Democrats can vote it in.
All right. Thank you very much.
You're welcome.